Hello and welcome to another revision session. This one's going to look briefly at surgery through the ages and how it changed, what the similarities were and what sort of differences there were. So let's start by looking at Roman surgery. So Roman surgery, there were many problems with Roman surgery. These included blood loss, patients could die from bleeding out, lack of anatomical knowledge, so the surgeons didn't know enough about the inside of the body to treat very much that was going on deep inside the body or understand what problems there were. Infection, so even if you did treat someone, they might die from germs in the wound, which they wouldn't have known about. And also pain was a major problem. Pain in itself is unlikely to have killed the patients in surgery, but pain would make the patients move while surgery was going on, and that would increase the risk of something going wrong, which might kill or injure further a patient. Well, what sort of solutions were there, and what steps forward did the Romans make? Well, they did have training for their army surgeons. This was particularly important for the Roman government because they put an emphasis on having fit and healthy soldiers, so they made sure that their army surgeons were trained as much as they could be, mainly through use of books in libraries like Alexandria. They could do simple surgery in Roman times and ancient times, so things like cutting visible growths and tumours off the body, not ones which were internal that you can't see, but things that they could see. And again, simple surgery on things they could see, like broken bones and fractures, where they could see the injury had taken place. They'd be able to reset those with clay casts and mud and things like that. There was a continuation of some supernatural surgeries, which we'd seen in earlier periods, going right back to prehistory, such as trephining, also sometimes called tree planning, which is where they would drill a hole in the patient's head to try and let evil spirits out, which they thought might be causing illnesses. You'd be unlikely to see an army surgeon using this kind of thing, but perhaps more local healers. And again, there were also supernatural surgeries going on in Asclepions, which were temples to the god Asclepius, originally actually an ancient Greek god, but one that many Romans also adopted, along with their own sort of medical gods and goddesses and various other things. So we do see a continuation of some supernatural elements within surgery. They were able to clean wounds. They used things like wine and vinegar, and they noticed that they were quite good at cleaning up wounds. However, they weren't able to fully prevent infection, and many people still would have died from infections. So let's look next at the medieval period and surgery that you would have seen in the medieval period. Okay, well, many problems continued. So we still had problems with blood loss. There was no real way for them to stop patients from bleeding out. Anatomical knowledge, there's a real lack of that still, as they continue using the same works of Galen and Hippocrates before, so they repeat the same mistakes, and they're not allowed to do dissections of human bodies, so they still don't really know enough about the inside of the body to be confident enough to treat many internal injuries and illnesses. Infection continues to be a major killer of patients in the medieval period after surgery, so even if they survive surgery itself, they might die of some kind of infection. Pain, again, patients moving and then causing further injury, and it makes it very difficult for surgeons to do very intricate operations because their patients are moving around, so there's no way they would do something where they might accidentally cut some sort of important blood vessel or something like that. And training was still an issue as well. So we see things like barber surgeons, local healers still attempting to do minor operations, and they would be learning mainly by apprenticeship. Some of them may have been more successful in those operations than others. The church, as we've mentioned, was running university training, and they limit the amount that people were able to learn. So there's a very limited change in terms of how much they're able to do in surgery in the medieval period. Continuation of supernatural things like trephining of some local healers, and attempts to clean the wounds, but it wouldn't necessarily prevent infection. Again, also access to surgery was potentially more of a problem in the medieval period than in the Roman period, as the government was less interested in making sure that they provided that kind of surgical healthcare. There were hospitals, but the hospitals were set up by monks and nuns in churches and monasteries and abbeys and things like that. And only 10% of these hospitals actually did any kind of treatment for patients. And even that treatment definitely wouldn't have involved surgery. It would have been things like herbal remedies and prayer and rest and food and water. 90% of the hospitals would have been care not cure, and even within that 90%, about 20% of the hospitals that the churches set up were just for pilgrims, and effectively they were almost like a lodging place or somewhere for the sick, or not the sick, the elderly or the homeless to go and to stay if they had nowhere else to go. So you had to be very rich to actually afford any kind of surgical treatment anyway. In terms of attempts to overcome the problems of blood loss in the medieval period, we do see attempts to overcome this problem. So if a patient was bleeding a lot during surgery or on the battlefield, then they would attempt something called cauterizing. So they discovered that you could potentially stop someone from bleeding by using a really hot metal iron to burn them in the place where the bleed was taking place, to try and force the wound to seal itself up more quickly and hopefully stop the patient from bleeding. In a way, this would have worked. It was incredibly painful, but the problem with it was that often there were infections after cauterization. So even though the patient didn't die of blood loss, they might die of an infection following this. In terms of attempts to dull pain during operations and stop the patients from moving, there were early attempts to do this in the medieval period, which included things like use of herbs like poppies, and it's called opium, the drug that they were using. But this was really dangerous. It didn't dull the pain very much, and it could actually kill the patient if they had it in too high a dose. So not particularly successful in the medieval period in overcoming any of those issues. In the Renaissance, we see a continuation of many of the same issues that we've seen previously, but there are some steps forward. So there are still problems with blood loss. Patients could die of bleeding if they were being operated on. There were patients in pain still in the Renaissance. They moved about a lot. There were attempts to use alcohol, opium, and things like that to dull pain and stop the patients from moving, but alcohol thinned the blood and made them more likely to bleed out. Opium, again, as we've mentioned before, the poppies could, in too high a dose, cause death. Infection continued to be a major problem. They didn't understand about germs yet. That's not till 1861. And so there was no way of really preventing infection, and training was still an issue as well. Although universities continued to train doctors and the church's power decreased and there was more questioning of old knowledge, as we'll see, even the steps forward that were made weren't quite enough to enable surgery itself to take steps forward in this period. So, for example, it's true that there were more, because of the printing press, more books were widely available with prints of really detailed prints and more accurate prints of the anatomy of the human body. And we know that there were new steps forward. So, for example, Harvey made discoveries about the heart, Vesalius made discoveries about the liver and the muscles and all sorts of things like that. But these new anatomical pieces of knowledge weren't enough for surgical advances, because Harvey's discoveries about the heart being like a pump and the circulation of the blood couldn't actually be used to treat anyone in surgery until they made discoveries about things like blood groups, and were able to sort of have blood banks so that they could give blood to people and therefore actually do some kind of surgery on the heart. So even though he understood better the sort of the anatomy, it would be a long time before that knowledge could actually be used to treat patients in surgery. Similarly, they can't do a heart transplant or anything like that, or a lung transplant, even if they know more about it, because they would need a bypass machine to help still continue to pump the blood around the body and make that possible. So even though in the Renaissance they start to do things and make discoveries which will later on make better surgery possible, they aren't quite able to do that yet. In terms of blood loss, an individual called Pare comes along, and he uses silk threads or also known as ligatures. They're a bit like really thin ribbons. And he uses them as a less painful way of stopping bleeding. So rather than using a hot metal iron to burn a patient, seal the wound like that, he's tying silk sort of ribbon threads called ligatures around blood vessels to try and stop the bleeding. But this isn't entirely effective in the Renaissance, really, in overcoming blood loss problems, because it could still lead to infection, killing a patient if those silk threads weren't completely pristine. So in an operating theatre, maybe they might be more clean than on a battlefield, where they're almost certainly going to lead to infection and death of the patient. But even within surgical theatres, at this time in the Renaissance, most people still believed miasma, bad smells causing illness. So if the silk threads didn't smell, then they would think that they would be fine. So they might wash them in cold water and reuse them. But that might still have germs on it from a previous patient, or from the floor or somewhere else, and that could also still lead to infection and kill patients. So not looking too brilliant in the Renaissance. They continue with simple surgeries, cutting tumours that they can see, resetting broken bones, amputations, but no sort of intricate internal surgery due to the reasons discussed. If we sort of swoop along here to the industrial period, the Victorian era in Britain, 1750 to 1900, we see problems continuing: blood loss, pain, infection, and opposition is a key reason in this period, in the industrial period, that we see a lack of steps forward actually in surgery. So there are some attempts to overcome problems we've seen. So anaesthetics overcome the problem of pain in surgery. The first attempts in this period were with things like ether, which is laughing gas, effectively. The problem with it wasn't very effective because patients would still cough. So even though they weren't in pain, if they're coughing, they're still moving. That could still lead to accidents in surgery. And also, ether was incredibly flammable. So if you knocked over the ether during surgery that the patient was meant to be inhaling, then the whole surgery the room might catch fire because they're using gas lamps which have flames in them. So it's a real step forward in 1847 in the 19th century when a man called Simpson discovers something called chloroform, which was the first much more effective anaesthetic, something which stops pain. Initial problems included the fact that too much chloroform, if you were just sort of doing what they initially did, which was experimenting by just pouring this liquid chloroform onto a cloth and putting it on someone's face, that was really, really dangerous because too much chloroform would stop someone's heart and it would kill them. So we have another individual come along and make it much safer called John Snow, and Snow invented an inhaler which very carefully controlled the dosage that people were being given, so that they were able to use chloroform as a painkiller, as an anaesthetic, without it actually killing people. So initially there's opposition to it, but it's something that really has an impact in making people less likely to oppose it. In 1853, Queen Victoria herself uses chloroform and raves about it when she has the birth of her 8th child. And after that point, most people start to trust the idea of anaesthetics and use them. But as we've mentioned, opposition is a key reason that surgery doesn't move forwards greatly in this period. Some people opposed anaesthetics because they believed pain was part of God's plan. Maybe it was a punishment, that we shouldn't be stopping it ourselves. Some people just opposed it because they were afraid of it. They were afraid of maybe dying as a result of the anaesthetic. As we've mentioned, before Snow's inhaler, initially we see lots and lots of deaths from chloroform, including in 1848 there's a story of a lady who goes in to get an ingrown toenail removed and attempts to use this chloroform and dies because she's overdosed on chloroform. And also we actually see an increase in deaths after anaesthetics, painkillers are introduced. And this is not necessarily as a result of the anaesthetics themselves, but it's because anaesthetics mean patients are staying really still. Now that means surgeons for the first time feel happy that they could do operations deep in the body without being afraid that their patients would move and cause injury or illness or death accidentally. But whilst they're doing these deeper operations, because their patients are still because of anaesthetic, painkiller, infections they're not being able to deal with those yet. So until they have antiseptics to kill infection, there's a massive increase in death rates in surgery in the first half of the 19th century because more surgeons doing deep operations, and there are more infections deep inside the body which were harder to treat. So antiseptics were an even more important step forward for surgery in this period, the Industrial Revolution period, the Victorian period. In 1867, so just after germ theory in 1861 and 1865, when everyone starts to accept it, in 1867, a man called Lister comes along and he invents a carbolic acid spray, and this kills infection, it kills germs. And it leads to there being no deaths from blood poisoning on Lister's wards, and by 1897, so about 30 years later, he's been so successful in this use of antiseptic to kill germs and kill infections that Lister becomes Baron Lister. He's given that title by the government. However, again, there is some opposition to the use of this antiseptic, the germ killer. One reason is cost. Some surgeons didn't like the added cost that having to use this would have. Conservatism, people don't always accept ideas straight away. And also, it did things like cracked surgeon hands when they were using them, so it could be quite uncomfortable as well. There are some steps forward in this industrial period, 1750 to 1900. So there's an attempt at the first blood transfusion, first human-to-human blood transfusion, which happens in 1795. Unfortunately, it wasn't successful. And we see another attempt by a man called Blundell in the 1800s in the 19th century, so 1825 to 1830. He attempts 10 more human-to-human blood transfusions, but they're really unsuccessful. Half of the patients actually died after receiving the blood, and that's mainly because blood groups weren't discovered until 1900. Training is a change that we see in surgery in this period. So, for example, the General Medical Council set up and they have to start passing exams in order to practice, which meant that the surgery was more professionalised than it had been previous eras that we've been looking at. And we also see new technology coming along which makes surgery more effective. So, for example, the hypodermic needles that were invented in 1853 enabled people to use more exact measures of doses of drugs, which would be much safer than before. This industrial period also sees some breakthroughs, like, for example, Florence Nightingale. Although she's not a surgeon herself, she helps with surgery in the Crimean War. She helps on the battlefield wards, and she encourages surgeons to clean their hospitals and their equipment, and decreases the death rate from infections and things like that by about a half. We also see Semmelweis in this period, so in 1846, so a little bit before germ theory again, Semmelweis comes up with the idea that washing hands, doctors washing their hands and surgeons washing their hands before operating in particular, he was interested in maternity wards, and doctors seemed to have a much higher death rate with their patients than the nurses did. And he discovered that if surgeons washed their hands in between treating patients and performing surgeries, then it massively decreased the death rate to from around sort of 50% to about 2%. Unfortunately for him, he wasn't able to explain why his idea worked. So actually, it wasn't really accepted, and he made a few errors as well, in that he wrote a book about his ideas, but rather than making it very scientific and professional, he slated lots of other doctors and called them murderers and that sort of thing, so he didn't manage to get people on side, and in actual fact his idea was never really widely accepted. So there are some moves forward. There's attempts for the first time to come up with a way of using transfusions, although it's not successful in this period. The major steps forward were probably with pain and infection, because they have the invention of new anaesthetics like Simpson's chloroform and antiseptics like Lister's carbolic acid spray. So then finally, let's have a quick look at 20th century surgery. Okay, well, 20th century surgery, we have problems still being faced, so infection is still a potential problem in the 20th century. Sometimes it could be access to antibiotics to use or antiseptics to use, or it could also be a cost thing. So does everyone have the money to invest in that kind of thing. And there's also still problems with knowledge of anatomy and the body and that kind of thing. Although in this stage of medical progress, it's more complex. So it's not just knowing where things are in the body, but it's looking at more complex things like DNA and trying to understand that, which could be a bar to progress for medicine. So what things do they do to overcome problems in 20th century surgery? Well, we look at the problem of blood loss. In 1900, a man called Karl Landsteiner comes along and he discovers blood groups. So O, A, AB, and B. Understanding that some patients can only accept certain types of blood and that O could be the most widely used, enabled them to start doing the first successful transfusion. So unlike in the industrial period where we'd seen about half the patients die because the blood was being rejected, now that they understood that certain blood groups would be accepted by all patients, like O blood, Reuben Ottenberg in 1907 in New York does the first successful blood transfusion. They also come up with a way of storing blood. Previously, a major issue had been, even if they had been able to successfully transfuse blood, you had to have the two patients sat next to each other, one who was donating the blood and one who was taking it. And that's not practical in many situations, like in surgery or potentially where you're treating soldiers on battlefields and things like that. In 1914, a Belgian scientist comes up with a discovery, which is sodium citrate, which stops the blood from clotting, and that enabled them to start having blood banks. So the first blood bank was set up in 1917 during World War One, which shows that war played a role. It was a factor in the step forward for medicine. We also see massive steps forward in technology in the 20th century, which enable patients to be treated much more effectively and illnesses to be picked up at a much earlier stage. So, for example, CT scanners and MRI scanners, which enable 360-degree scans of the inside of the body, and therefore things can be picked up when they're much smaller and much earlier on. So an even more advanced form of the X-ray that we'd seen being developed at the end of the 19th century. We also see keyhole surgery being able to develop towards the end of the 20th century, where they're using little cameras and just making very small incisions in the body, thereby massively cutting the infection risk. We also see the development of things like the defibrillator, which can be used to restart the heart, bypass machines, which can be used to artificially do the job of a heart or the lungs, whilst a transplant of an organ takes place. So it enables massive steps forward in the types of surgery that can happen. And things like dialysis machines, which will filter the blood for a person if their kidneys stop working. We've got ICUs as well. So in countries like Britain, where perhaps it's slightly more economically developed and they can afford to invest in it, especially after the NHS and new taxes and National Insurance Acts, we see the intensive care unit, so rooms with lots and lots of technology all in one place that can be used to treat patients in emergencies. Communication also plays a major role in the improvement of surgery in the 20th century. So medical journals meant it was easy for people to swap new ideas. For example, the Lancet's one of the most famous ones. There are many international conferences, new travel methods and things like aeroplanes, faster trains and transport meant it was much easier for international ideas to spread internationally. The invention of the internet also helped this, and widespread publication of newspapers. And finally, war was a major reason why in the 20th century we see massive steps forward in surgical progress. So World War One, we've mentioned briefly before, blood banks being set up in 1917. We've got people like Harold Gillies inventing the pedicle, the first sort of facial plastic surgery. And we also see them starting to discover new ideas about mental health as well. So PTSD, post-traumatic stress disorder, although at the time that was known as shell shock, starts to be picked up as well by doctors. We also see wider training on existing technology. So the X-ray was actually invented by Karl Landsteiner at the end of the 19th century, but hardly anyone was actually trained in it, and hardly any governments or countries invested in the technology because it was expensive. But due to shrapnel injuries in World War One, suddenly governments want to invest in it and they want to train people in it much, much more widely so that they can help soldiers on the front lines or in the battlefield hospitals. So they train huge numbers of people in how to use X-ray machines, and that's then carried back to public places at the end of the war. So that's a quick overview for you in surgery through the ages. one thing that would be a good idea to do with your revision is perhaps think about similarities and differences over time. So what problems continue throughout all the periods? When are the key turning points in the history of surgery? And what do you think the most important steps forward were? Good luck with your revision.